Good morning to everybody. Ellen Ayurveda PG Entrance Coaching Center. Today's class is concepts related to surgery or surgical concepts and their wonders in the system of Ayurveda, especially in Sushi Samhita, how narrated or described, and we will come to know on what ground he became the father of surgery. See, everywhere today you can see his efficacy. Everywhere today in the world you can see how the world accepted. Why today we are facing problem, you have to understand here. See, concepts are there, surgical procedures are there, applications are there. See, the point is that the frequency might have raised, it depends upon so many factors. The number of frequency need not be counted. The concept is there or not, surgical procedures are there or not, how the pre-operative procedures and how the post-operative procedures and operative procedures and the surrounding factors like drugs etc. and their application have been clearly mentioned, and they have mentioned the strategy of the ulcers or what to say sodha or edema surgical related aspects clearly mentioned. Let us see in each chapter Susutta Sutra Sthana how they have clearly mentioned on what ground you become father, we will come to know. This is the criteria. One by one, if you are analyzing all the things, you will come to know. So blindly we cannot reject our science. See now, in the chapter number 15, he has clearly mentioned about formation and elimination of the metabolic products and related with three doshas. He has clearly mentioned. The question may come like this: formation and elimination of the metabolic products and related with the doshas, how and where mentioned. Chapter name, sthana name, or Grantha name. Anyone may be asked. I am telling you very principle very clearly. Just you follow the principle and apply it. 16th chapter deals with grafting operations. See, 16th chapter deals with grafting operation, what we are calling generally Karna Vyadha. See, Karna Vyadha, even not Karna Vyadha, in rhinoplasty, all the things have been clearly mentioned and performed in those days. In those days, clearly they have mentioned. Now, grafting is mentioned in chapter number 16, and 17th deals with the distinction between the suppurative and non-suppurative swelling. Suppurative and non-suppurative swellings have been clearly mentioned. That is chapter number 17. So, what we are calling Ama Pakva or Ama Pakva Sodha. Dressing and bandage of the wounds and ulcers. Dressing and bandage of wounds and ulcers clearly mentioned. That means after doing any surgery, maybe minor or minor, what is what, how to bandage, what is what, or related to wounds, everything very clearly mentioned. Chapter number 19, nursing of the surgical patients clearly mentioned. Nursing of the surgical patients mentioned. What we are calling generally Vrananyupasana. That is chapter is Vrananyupasana, nursing of the surgical patients. Physiological actions and properties of the different foods and drinks have been clearly, very clearly mentioned. Hita Adhyaya. So which is Hita, which is Ahita, what to be taken, what cannot be, what need not be, what has to be. Everything dealing with what he has mentioned. So you try to understand what is there in Sushruta Samhita. Just open the things, don't keep aside. Then today we will blame now that is not there, this is not. It is there. Application is most important. In application, what happens? The technique comes into operation. What is the technique? Technique today, what stands here today will not stand tomorrow. The technique is changing. The concept is not changing. That we have to remember and feel regularly. Very. So that is called dedication. Now, next we are coming to the physiological actions and properties of the different foods and drinks mentioned in chapter number 20, that is Hita Hitam Adhyaya. Next one, different types of ulcers clearly mentioned. What are they, what is what? You have to go through it. Then Vranaprashana, that is called as Vranaprashana Adhyaya. Next chapter, opening of the abscess, the question may come like this. Opening of the abscess mentioned so and so Samhita, so and so Sthana, so and so chapter. The question may come like this. Opening of the abscess or Vranasrava, generally Vrana means you will think about the surgical aspect, Susrta Samhita. But Vrana related aspects are mentioned in Charaka Samhita also. So you may confuse. That is why you have to go through the chapter number, sana number very, very clearly. Treatment of curable and incurable diseases. Krutya Krutya. Krutya Krutya Vidhi. Krutya Krutya Vidhi clearly mentioned. That is number 23. 24. Deal with the classification of diseases Vyadi Samuddesiya Vidyaya. Vyadi Samuddesiya Adhyaya. Chapter number 24 describes the classification of the different diseases. How diseases have been classified clearly, how the diseases have been clearly classified, they have mentioned. Next, different surgical processes, Shastra Vidhi mentioned in the chapter 25. Sushrta Sutrasthana, they have mentioned different surgical processes. See, how many steps are there? What are the procedures? What is the surgery prior to surgery, during surgery, after surgery? What we require? What type of instrument we require? And then how to sharpening this one, payana, all the things. And then how to protect them, how to sterilize them, how to use them. After that, how to take care of them. Then after that, dressing of the wound. Regarding the dressing, what type of dressing, what is what type of dressing, what is what, it is clearly mentioned. So, application is lacking, you start it. So, we cannot say that it is not there, so it is not yours, it is ours, like that we cannot say. See, you have to go through the history also. You have to go through the history. If you are going through the history, you will come to know. But if all the present legal, present technology is favorable to the science, naturally you can club it. Nothing wrong in that. So it becomes perfect. Now, in the chapter number 25, different surgical processes have been clearly mentioned. Shastra Vidhi, that is. Next one, in the chapter 26, embedded external splinters and internal obstructions mentioned. Embedded external splinters and internal obstructions clearly mentioned. That is called Pranashta Adhyaya. That is called as a Pranashta Adhyaya. Chapter number 27, surgical methods of removing the splinters and obstructions. Again, see, in one chapter, he has mentioned what is embedded external splinters and internal obstructions. But in another chapter, he has clearly mentioned how to remove the splinters and obstructions. How to remove the splinters and obstructions clearly mentioned. Next chapter deals with the fatal and unfavorable symptoms in progress of surgical cases. If you are doing or you have done a surgery, when you are doing a surgery, done a surgery, what are the precautions to be taken and what are the fatal conditions and fatal and unfavorable conditions after doing surgery, while doing surgery, clearly mentioned. You have to go through it. Next one. Vrana Vijnana, that is called as Vrana Vijnana Adhyaya. Next one. Favorable and unfavorable signs related to the diseases also mentioned. Favorable signs and unfavorable signs related to diseases have been mentioned. Favorable and unfavorable signs related to disease mentioned. That is Dushta Swapnani Darshana. This is called Dushta Swapnani Darshana. Next, in chapter 30, hallucinations and sense perversions mentioned. Hallucinations and sense perversions mentioned in illness. Panchendriya 31 and 32 deals with the changes in the body organs and features, indicating the evil futures. Chapter number 31 and 32 deals with the body organs, their futures, indicating the evil futures. Chaya Swapna Kriti Adhyaya. This is called as very, very important. Chaya Swapna Adhyaya. 33 deals with incurable forms of diseases. 33 deals with the incurable forms of diseases and their diagnosis and palliatives. And see how a military takes care of the country. In olden days, how he has given Susruta has given importance to military people in those days, even in those days. So he has mentioned a separate chapter related to the medical care in the military. That is called a Yukta Seniya Adhyaya. That is a Yukta Seniya Adhyaya. Even today the same system is going on. Even today the same system is going on. Clinical next one. Clinical indications of the diseases and estimation of the longevity clearly mentioned. Clinical indications of diseases and estimation of longevity. How to assess the longevity? The criteria related to that one, the credentials, what we require for longevity mentioned there. That means that is why Ayurveda is Swastarakshanam, Swastasya Swastarakshanam, Aturasya Roga Nivaranam. Apart from, even in the case of Atura, they have mentioned the credentials regarding the longevity. 36 number deals with cultivation, collection and preservation of the plants. Bhumika Adhyaya. Cultivation, collection, preservation of plants. Bhumika Adhyaya. See, that means what we require to perform or while performing or for a surgery, everything clearly narrated or described, whatever word you use. Whatever word you use, it is clearly mentioned. 37 is the medicinal remedies for boils and ulcers. That is called Misraka Adhyaya. Medicinal remedies for boils and ulcers. After doing surgery, before surgery, during surgery, what are the medicines required, what are the preparations, combinations clearly they have described in Sushu Samhita. 38 deals with classification of drugs. Dravya Vijnanam Adhyayam. Dravya Vijnanam Adhyayam. Dravya Vijnanam Adhyayam. Dravya Vijnanam Adhyayam. 39 is purifying and passing. What is a Sodhana and Samana Chikitsa dealing. Purifying and pacification of drugs related mentioned here. Purification drugs and pacification drugs mentioned in chapter number 39. Purification and pacification of disease through drugs mentioned in chapter 39. 40 deals with flavors, properties of the different drugs mentioned. Dravya Vishesha Vijnana Adhyaya. Dravya Vishesha Vijnana Adhyaya. 41 deals with the properties of different dravyas, with specific features mentioned. Dravya Vishesha Vijnana Adhyaya. Dravya, here in 40, 41 you will confuse. 40, 41 you will confuse, so you go through, you pay some attention. Dravya Vishesha Vijnana, that is 40 number. 41, 40 you know very clearly, 41 what I have stressed here. Now see, regarding the rasa, regarding the taste and their physical value clearly described in chapter number 42, or what we are calling Rasa Vijnana Adhyaya. Rasa Vijnana Adhyaya. 43 deals with the administration of Vamana Dravyas. Prone question. Vamana Dravyas and Vimana Dravyas. Vamana Dravyas and Virechana Dravyas mentioned in chapter number 43 and 44. Vamana and Virechana Dravyas mentioned in chapter number 43 and 44. Anyone may be asked, Vamana Dravyas clearly in a specific manner mentioned in so and so Samhita, so and so Sthana, so and so chapter. Means 43 Sutra Sthana Sushrita. In the same manner applicable in case of purgatives or Virechana Dravyas also. 44 that is. 45 deals with the properties of liquids and substances. Drava Dravya Vidhi Adhyaya. Drava Dravya Vidhi Adhyaya. And 46 last one deals with the different foods and their preparations. Annapana Vidhi in the chapter number 46 it is clearly mentioned. Now let us salute our Lord Dhanvantari and the father of surgery, Susruta, who has constituted so many fundamentals, principles, whatever you say, and their related applications for surgeries in pre-operative care, operative care, and post-operative conditions. Okay, today's chapter deals with the important bits. One or two bits are prone in PG examinations, or this will help you in any exam, B Pharm, M Pharmacy, Ayurveda entrance examinations also. See, that means what happens, when the question comes, the examiner will select the particular related aspect. Any Samhita, because Ayurveda is ocean. What we know is very least, subject is vast. What we know is very least, subject is vast. But what we are dealing is not at all waste. Okay, try to understand this quotation. How much we have to study, you will come to know. Thank you. Today's class is over.